Hey, I'm Dr. Joe and I am to LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here. I don't do boobs, bellies, or butts. I'm a face guy. I'm also a teacher, an author, and a surgeon. And today we're going to talk about deep plane face and neck lift. So I haven't posted anything in the last couple weeks because I've been pretty busy speaking at meetings. I was just in Rio de Janeiro and also working on some other academic publications. So what I'm going to do today is show you 16 recent cases of deep plane face and neck lift. This is my favorite procedure. I just love doing facelifts. We do about 100 a year. And unlike body surgery, which you can hide if it's mediocre, you got to be good at facelift surgery because it's out there for the whole world to see. So about 65% of my patients are from out of town. And although this is a high honor, it makes it difficult to get before and after pictures. Some people just aren't good at taking pictures or they forget to send them. And for people that are in town, obviously, they can come in and take pictures. So I'm going to show you some pictures that range from the next day after surgery to maybe a week or 2 weeks later to 3 months later. And you can see kind of what a deep plane face and neck lift does and the changes that you see. Now, although this procedure has been around for decades, it's really been refined in the last probably 8 or 10 years. And social media has helped to spread the word and the current techniques about this procedure. So you have the facelift part of the deep plane facelift, and you have the neck part, the deep neck lift, and these are done together. I think the biggest changes that I have seen in my career, and I've done over 1,600 facelifts, is what happens in the neck when we do deep plane neck lift. And it is a more aggressive technique on patients, especially patients that have big, thick necks or a big turkey gobbler with skin excess. And we're removing platysma muscle, superficial and deep fat. We're reducing the digastric muscles, reducing the submandibular glands. We're just doing a lot more things to give a much more sculpted profile. And even if you add a chin implant on that, on patients that are candidates, it's pretty dramatic. So I think our results have just been better with this technique. And it's not a technique for beginners because these are advanced surgical techniques. And again, I feel very comfortable with this. So I'm going to show you some pictures again, and you get an idea of what happens and what the recovery is like for deep plane face and neck lift. I'm Dr. Joe, and I am too. So we're going to take a quick look at 16 of my last deep plane face and neck lifts. And as I said, I have been really busy. And instead of doing these one case at a time, I've let them stack up. So what we're going to do is look at the results. Okay, so here's a patient uh, before, and this is 24 hours after. So of course, patient's still lumpy and bumpy, and we did laser resurfacing. But we did the deep plane facelift and the deep plane neck lift or deep neck lift, which really makes a difference where we uh, remove excess tissues, trim the digastric muscles and the submandibular glands. And again, same patient, one day after surgery. And all this ruddiness here is from the laser. So patient in the looking down pose, and it's going to be just a great case. And I'm so excited when I do these. Here's another patient, again, 24 hours after her surgery. Um, and you can see the difference by reducing all of these excess structures in the neck and similarly in the face. Now, this is a patient, this is actually a younger patient who had really hereditary issues in terms of a poor profile. And by doing a deep plane face and deep plane neck lift, we're able to give her much more definition in this area. This is the same patient from the three-quarter view and same patient from the looking down view. And these pictures were taken about 3 months after her surgery. So again, deep plane facelift, deep plane neck lift, going to be a home run. Here's another patient from out of town, and again, that's why some of these pictures aren't fully healed. And this patient is before, and she's had a previous facelift, and this is probably about several weeks after deep plane face and neck lift. And I also did her upper and lower eyelids, but you can see that we've reduced this extra skin, reduced her submandibular glands and her digastric muscles, as well as extra fat in this area, and have a great improvement. Here's the same patient um, from the right three-quarter view. And this is another patient who had a facelift and a revision lift with deep plane face and neck lift. And she is shown here, I believe, 1 week after her procedure. You can see she's still bruised, but you can see the great improvement we're going to have. And we also did a chin implant here, which even helps the profile. And as the patient proceeds with her uh, recovery, this swelling will go down here, and obviously the bruising will improve. But by removing extra fat, extra platysma muscle, extra digastric muscle, extra submandibular gland, and adding a chin implant, we've made a tremendous difference in her profile. And again, this case will be a home run. This is another patient, and she was kind enough to send me pictures from her house. So we have different backgrounds here. And this is probably about 8 weeks after her deep plane face and neck lift with chin implant. And again, you can see the excellent improvement in her profile from where she started. We've reduced decades of aging from this patient. Same patient from the left lateral view. And by reducing all this extra tissue and performing the deep plane facelift with a deep neck lift, it makes an incredible difference on the jowls and on the extra neck skin if you look at this patient's profile. And here is a frontal view, and you have a happy patient and a happy doctor. Here's obviously a male patient, and this is 24 hours after deep plane face and deep plane neck lift with a chin implant and laser resurfacing. Again, these patients leave town about a week after their surgery, so it's really hard to get extended follow-up pictures, and some patients are nice enough to send them, but this, again, is going to be a home run for this patient. Here is a patient that didn't have a lot of fat, but nonetheless had extra skin and tissues. And this is 1 week after her surgery. And obviously, she's still bruised, but this profile is going to be very nice. Um, Here's another patient, and uh, she is shown here 1 week after her deep plane face and neck lift. And you can look at her profile and see that it's going to be a really nice improvement. Um, when patients have this type of aging in the neck with wrinkles, um, it looks a little swollen after their lift, but a lot of that goes down. Same patient, and this patient had extremely heavy jowls, and this is where the deep plane facelift really helps. And a lot of extra tissue and skin and deeper tissues in the neck, and this is where the deep plane neck lift makes such a difference. Here's same patient in a forward view, and this is going to be a great case and a really happy patient. And here she is from the other side and from the other lateral view. Again, another patient that didn't have a lot of fullness in her neck in terms of fat and muscle, but we did perform deep plane face and neck lift, reduced her anatomy in that area and her submandibular glands, and she's going to just have a beautiful profile. The looking down pose of this patient, and obviously is still bruised here. I think this is probably about 2 weeks after her procedure, but it's going to make an incredible difference. Another patient, this is 1 week after deep plane face and neck lift, and uh, you can see the improvement of the jowls and the tremendous improvement of the profile. Looking down view. And the reason we do this view is because it shows the bunched up tissues and it helps you see the difference um, in the before and after. Another patient, this is before and 1 week after deep plane face and neck lift. Yet another patient, same situation, deep plane facelift, deep plane neck lift. This patient did not opt for a chin implant, and if she did, it would have made even a much uh, more dramatic improvement. This is a patient. We performed upper and lower eyelid surgery, some partial laser resurfacing of the eyes and the upper lip, deep plane facelift, and deep neck lift. Again, looking at the fullness in the neck before surgery and the nice profile. Again, a chin implant would have even made this bigger, but not everybody opts for implants. Even without an implant, this is going to be a home run. Another view of the same patient 1 week after her procedure. And these are the cases that I have saved up. I hope you enjoyed this presentation. And I love doing facelift surgery, and deep plane face and neck lift has made an incredible difference on my patients. This is a popular procedure that is going to be here to stay. And if you have any questions about cosmetic facial surgery or deep plane facelift, you can reach us at lovethatface.com. I'm Dr. Joe Nyamtu. Thank you for the greatest gift of all, and that is your time.